Hi, we are Reach.AI, which is a supply chain management tool powered by artificial intelligence. We aim to provide the public health sector with a tool that will analyze the social determinants of health for identifying the hotspot trends within vulnerable populations in the Commonwealth of Pennsylvania. COVID-19 is an ongoing problem that has significantly impacted society. The Hispanic and Latino communities are vulnerable populations that we identified with the assistance of Penn State's Project Reach. Imagine these two personas. First, you have a Hispanic adult male in rural Pennsylvania with a family of three working a Labor Day job, along with many coworkers. Second, you have a Hispanic adult male in an affluent part of Pennsylvania working with a family of three working remotely on their laptop. The Hispanic adult male living in rural Pennsylvania is more likely to contract COVID due to their status in society. Penn State's Project Reach has many years of industry and research experience. With their guidance, we identified key variables for our risk index. According to the Pew Research Center, about 65% of Hispanic adults stated that COVID-19 is a major threat to their health. Also, 40% of the general public stated that COVID-19 is a major threat to their health.
Reach.AI is both a big data and supply chain management solution. We are utilizing machine learning to analyze healthcare data so that healthcare workers will have improved public health outcomes while also raising awareness in the community they serve. Reach.AI has an easy-to-use dashboard that has meaningful analytics, which will help improve supply chain management. Our analytics are showing how the social determinants of health are impacting the community. With that data, the supply chain distributors can act by identifying which areas are most at risk and distribute medical attention to those areas. This is how a social worker would be introduced to our company and our company's goals. This is a piece of what will come. The rest of this page will be flushed with data analytics, but for now, we have a piece of important data regarding the social determinant of life expectancy. Once we receive more funding and further support, we will have more access to data sets outside of the Robert Wood Johnson Foundation. We will be leveraging IBM Watson Studio Desktop to analyze the data. The AI will identify trends, which will provide insight to the data.
We hope to work with these entities for our next steps. Once COVID subsides, then we will focus on the diseases of despair. We will capitalize our market opportunity by onboarding a small marketing team. We aim to become a nonprofit with our main goal being to benefit the public. According to one of our mentors, we will need at least $800 for establishing Reach.AI as a nonprofit. For our revenue model, we plan to have a subscription-based system for our clients. About $1,600 a month with about $20,000 spent annually. As for our competitive advantage, Penn State's Project Reach stated that their senior biostatistician earns about $400 a day to analyze their data, while we're asking for $400 per week to cut time and costs. Their senior biostatistician earns about $100,000 per year, while we are asking for about $20,000 per year. One key value proposition is having automated sourcing of clinical data for identifying which patients are more suited for specific clinical research trials. Another key value proposition is automated analysis of healthcare data for our clients. We aim to improve the public health outcomes while also raising community awareness.
When we reach the MVP stage, we hope to have a more refined product similar to this here. As a healthcare worker, I would use this dashboard tool and first log in to my account. After logging in, I would have access to meaningful analytics, which will help me analyze which zip codes are identified as hotspots for social determinants.